Hello viewers, I'm Professor Dr. Kavita M. Triplam College of Nursing, Chennai. In this video, I'm going to talk about aseptic non-touch technique. The objective of this video is the viewers will be able to understand the key terms related to ANTT, that is aseptic non-touch technique, know the meaning of ANTT, list the causes of ANTT, identify the key principles of aseptic non-touch technique, demonstrate knowledge of differences between standard and surgical ANTT. So let us move into the major content. So before that, let me tell you some of the key terms that are related to ANTT, that is aseptic non-touch technique. The first key term which should be familiar ourselves is the asepsis. That is either medical or surgical asepsis, which means absence of pathogenic microorganism or its toxins from the blood or tissues of the human being. The second term is aseptic technique. It defines the infection prevention method and precautions taken during invasive clinical procedures to prevent the transfer of microorganisms to the patient. Here comes the today's topic of ANTT, aseptic non-touch technique. The simple meaning of ANTT is identifying the key parts and key sites of a procedure and not touching them either directly or indirectly. So let us see what is the two terms, that is twin parts of the ANTT. The first part is the key site, or we call it as the susceptible site, which means the open wound or the insertion or the puncture sites for any invasive medical devices is the key site. And the key part is the part of the instrument which is coming and touching the body part is the key part. That is the end of the venflon which first comes in contact with the human skin during the invasive intravenous cannulation. That is when the IV port, that is when it comes in contact with the human body part. That is the key part we say. The next is the invasive procedure. It is any medical procedure that invades the body, usually by cutting or puncturing the skin or by inserting instruments into the body part. So the ANTT is a contemporary and unique theoretical and clinical practice framework for maintaining aseptic technique intended for all clinical procedures, from surgery performed in the operation theater to the community care. So let us move into the concept of ANTT. So before that, one more thing which we need to be familiar is the healthcare associated infection. We all know about this healthcare associated infection. That is any infection acquired by a patient as a consequence of exposure to pathogenic organisms via healthcare staff or healthcare facilities is called as the healthcare associated infection. These healthcare associated infections are wide ranging, and it is widely accepted that poor standard of aseptic technique are the fundamental cause of preventable healthcare association. So any invasive clinical procedures which is performed in the hospital or in the community setting may many hundreds or thousands of times every day we perform these kind of procedures. So here we need to recognize the significant risk to patient that these clinical procedures bring and make the patient susceptible to healthcare associated infection. So here the ANTT clinical practice provides a framework or the logical or a standard set of principles and safeguards that clinical staff need to understand and comply with it in order to apply safe aseptic technique to a wide range of clinical procedures. So let us see what is this ANTT, the meaning of ANTT. ANTT is aseptic non-touch technique, which is a core nursing and medical skill that defines the infection prevention and control methods and precautions necessary during invasive clinical procedures to prevent the transfer of microorganisms to key or sterile body sites from healthcare professionals, procedure equipment, or the immediate environment to a patient. That is implementing the aseptic technique through standardization when performing the clinical procedures, so the key sites will be protected from invasion of the microorganisms. So let us see some of the uses of ANTT. Broadly to say, most effective way of reducing healthcare associated infections is through the application of a standardized ANTT for a clinical procedure. An ANTT helps to prevent the introduction of microorganisms into susceptible body sites. ANTT also prevents susceptible or sterile body sites to come in contact with the non-sterile items. Next, ANTT is the critical part of the practice in not touching a key part either directly or directly. These are few of the uses of ANTT, but simply to say ANTT is not touching the key parts or key sites to avoid the invasion of pathogens. So to understand the ANTT, we must be familiar with the foundation principles of ANTT. There are 4 foundation principles for clinical practice and 2 principles for the clinical and organizational management. So there are 6 principles of ANTT. The first 4 principles talks about clinical practice. So first we'll see the principles of ANTT in clinical practice. The first one is the asepsis is the aim for all invasive clinical procedures, including the maintenance and use of invasive clinical devices from surgery to community care. The second clinical principle talks about asepsis is achieved by key part and key site protection. That is, protecting the key parts and key sites from microorganisms transferred from the healthcare worker and the immediate environment to the patient. And the third clinical principle is ANTT needs to be efficient as well as safe. To make the ANTT efficient and safe, we need to decide about using standard ANTT for uncomplicated procedures and surgical ANTT for the complicated procedures. We will be discussing about these 2 concepts in later part of this video. The fourth clinical principles of ANTT is the need for deciding surgical or standard ANTT is determined by assessing the ANTT risk, which is based on the technical difficulty of achieving asepsis. Next, we'll see the 2 clinical and the organizational principles. These 2 principles mainly talk about the practice which should be standardized in the clinical area. That is, aseptic practice should be standardized in the clinical area so that everybody, whoever performs the invasive procedures, will be following the standardized procedures. But this is not always possible. Hence, we need to train our staff to identify the standard or the surgical ANTT. The 6th principle of ANTT is safe aseptic technique is reliant upon effective healthcare worker training and the environment and the equipment that are fit for purposes. Next, we'll see 4 safeguards that are being given for maintaining or using the ANTT. The 4 safeguards are, first one is the basic infective precaution. That means basic infective precautions, that is using the environmental control, hand cleaning, disinfecting medical devices, which significantly reduce the risk of contaminating key parts and the key site. The second safeguard is identification of key parts and the key site. And here, the key parts are the critical parts of the procedure equipment that I said, the tip of the benflan. That critical part of the procedure equipment that, if contaminated, are most likely to cause infection. And key sites are open wounds or medical device access site, that the part of the device which first comes in contact with the skin and enters or punches the human body is the key site. And the third safeguard is non-touch technique. These safeguards help us to prevent the invasion of pathogens. Non-touch technique is critical skill that protects both the key parts as well as the key sites from the healthcare worker and the procedure environment as well as the procedure equipment. Here, it is very essential. We have to follow this non-touch technique in standard ANTT and desirable following this non-touch technique in surgical ANTT. Why I say it is essential in standard, desirable in surgical, we will know it when we discuss about both this technique in later part of this video. Next, we will see the fourth safeguard is aseptic field management, which means protecting the key parts and the key sites from the immediate procedure environment. That is, both the surgical and the standard ANTT requires aseptic field management. These are the 4 clinical principles and 2 clinical management principles and 4 safeguards of ANTT. And these principles play a major role in practicing the ANTT. When we understand these principles, it becomes very easy for us to understand the core elements of the ANTT. The core elements of ANTT are, the first element is hand hygiene. That is, maintaining the hand hygiene or strictly adhering to effective hand hygiene practices using the systematic method performed prior to, during, or following the procedures of any invasive clinical procedure. Here, very well, we can use the WHO 5 moments of hand hygiene so that we will be able to remember this in our day-to-day practice. The second core element of ANTT is using the correct glove. That is, appropriate use of gloves and other personal protective equipment to reduce the transmission of harmful microorganisms. The third element is key part, key site protection. It is a method of identifying and strictly not touching and protecting from touch contamination of the most critical parts of the procedure equipment. The fourth core element is non-touch technique. That is, it is the skill of non-touching any critical parts or critical sites of an invasive clinical procedure. The fifth element is key part disinfection. That is, disinfection of the most critical parts of the procedure equipment that could provide a port of entry for harmful microorganisms. The last core element is aseptic field management. That is, selecting appropriate types of aseptic field to protect the key parts of procedure equipment prior to and during invasive clinical procedure. These are the 6 core elements of ANTT technique. Next, we'll move on to the ANTT risk assessment. This ANTT risk assessment is based upon the technical difficulty of ensuring key part and key site protection for any given procedures. Here comes the ANTT risk assessment to design upon surgical ANTT or the standard ANTT. To determine this use of standard or surgical ANTT technique, we need to consider the risk posed by the procedure environment, the procedure invasiveness, the number and size of key parts and the key sites, operator competency, and the procedure duration. Once we assess these variables, then we need to ask ourselves to maintain asepsis of key parts and key sites does the main aseptic field need critical management? That is, the critical management means where only sterilized and aseptic equipment may come in contact with the aseptic field. That is the critical management. The parts of the human body or the skin which can be touched only by sterilized or the aseptic equipment. That part is known as the critical management. If your answer is yes to maintain the aseptic critical management, then we need to select the surgical ANTT. If the answer is no to critical management, then we can go ahead with maintaining the standard ANTT. So what is the surgical ANTT? What is the standard ANTT? We will see in the later part of this video. Next, we'll see continuation with this selecting standard and the surgical ANTT. The choice of using standard or surgical ANTT will then determine equipment selection and technique. So how to select the equipment and technique will be seeing in this flow chart. That is ANTT Safeguards. So maintain asepsis of key parts and key sites. Does the main aseptic field require critical management? If this question is asked ourselves, if the answer is no, then we have to go ahead with maintaining the general aseptic field, microcritical aseptic field, non-touch technique, hand cleaning, and infective precautions. And if the answer is yes to maintain the critical management, then we have to think about using the critical aseptic field management, surgical hand scrub, microcritical aseptic field, and the non-touch techniques are desirable. And we also have to follow the infection precautions. Once you decide about using the general aseptic field or critical aseptic field, next you have to ask, can I perform this procedure without touching the key parts or the key sites directly? If the answer is yes, then you can use the non-sterilized glove. If the answer is no to then you have to use the sterilized glove in case of the standard ANTT technique. If you cannot perform the procedure without touching the key parts or key sites, then use the sterilized glove in surgical ANTT technique. This is the flow chart or the decision-making process for maintaining the aseptic field management and glove choice. Here, I'm here to explain you the meaning of general aseptic field, microcritical aseptic field, and the critical aseptic field. So let me tell you what is this general aseptic field. That is promoting the asepsis. This comes when key parts can easily be protected by caps and covers. That is, the caps and covers are called as the macrocritical aseptic field. I repeat, the caps and covers are, that is, the sterile or the aseptic caps and covers are called as the microcritical aseptic field. This main aseptic field is termed as the general aseptic field. That is, can be used in case of the standard ANTT. This is because it does not require any critical management, as it is promoting rather than ensuring the asepsis of key parts and the key sites. Here, aseptic technique is considerably simplified and typically involve non-sterilized gloves. Because we are using the general aseptic field, then we have to perform the procedure without touching the key parts and key sites with non-sterilized glove. The procedure can be performed. This is general aseptic field. Next, we see the critical aseptic field. Here, we need to ensure the asepsis during the procedure. And these are the fields utilized when the size or quantity of the key parts or key sites cannot be protected at all times with the covers and the caps. That is, when we use the larger part of the skin, like making the open incision during the surgery, or the intravenous central line placement, or any invasive surgery with large open wound, which demands large aseptic working area, then we need to cover that area with sterilized or aseptic covers or the wrappers. That is called the critical aseptic field. Here, maintaining the aseptic field is more complicated and it has to be managed as the key part. That is, the whole working space must only come into contact with the other aseptic equipment. That mainly we follow this technique covering the whole body part and exposing only the required, or the procedure part alone will be exposed, which comes in contact with the sterile or the aseptic equipment. Next, we'll see microcritical aseptic field. Here also we ensure the asepsis. That is the caps or the covers which comes in contact with the key parts during the procedures are ensured to be sterile or asepsis. The ensuring the sterility or the thorough cleanliness of the caps and covers, that is the sterile caps and covers, are called as the microcritical aseptic field. Hope now you understand this microcritical, general aseptic field and the critical aseptic field. Next, we'll see about the standard ANTT and the surgical ANTT. What is this standard ANTT? Because throughout this video, I'm talking about standard ANTT and the surgical ANTT. And standard ANTT is a process for safe and effective practice that can be applied to any aseptic procedure, and is used when carrying out a procedure that is technically simple, which is short in duration, that is less than 20 minutes, and only small key sites and equipment with the smaller number of key parts are being used. And it also typically employ a general aseptic field and non-sterile glove. That's what we discussed here, using the general aseptic field and the non-sterilized glove in the standard ANTT. Some of the examples of using the standard ANTT are procedures during wound care or intravenous cannulation, or using other intravascular devices, or ostomies, drains, using biopsies or venipuncture, taking blood cultures, IV therapies, administering IV medication, tracheostomy, site dressing, respiratory suction, or vaginal examination using instrument, assisted delivery. In all these situations, we can decide upon using the standard ANTT by making this decision of using the sterilized glove and using the aseptic field with the microcritical aseptic field and the non-touch technique. Next, we'll see the surgical ANTT. And the surgical ANTT is used for procedures in the operation theater, but it is not exclusively used only in the operation theater. It can be used in any clinical procedures that meet one or more of the following criteria. When the procedure is technically complex, when they are involved extended period of time, that is more than 20 minutes, when there is a large open key site and equipment has a large number of key parts, then we can decide about using the surgical ANTT. Next, we'll see how this ANTT framework can be applied into the clinical practice. To apply in the clinical practice, we need to involve two main objectives. The first objective of applying this ANTT is teaching and accrediting healthcare workers in the ANTT approach. That's I already told you. When we cannot standardize all the clinical procedures, then we have to train our staff to decide about using the standard and the surgical ANTT. So the training and accrediting the healthcare worker is the first step in using the ANTT in clinical practice. The second objective is standardizing the common clinical procedures with the ANTT Clinical Guidelines. So let us see these in detail. First is ANTT-Approach, which describes the application of ANTT principles and safeguards into the clinical practice, which already we discussed about using the safeguards and practice in the initial part of this video. We need to remember those 6 principles and 4 safeguards in clinical practice. There are 6 actions that should be performed by the healthcare workers every time we perform procedures on patient, so that we can protect the patient from the healthcare associated infection. These 6 actions are risk assessment, that is selecting the standard or the surgical ANTT according to the technical difficulty of achieving the asepsis, which we discussed in this video during this flowchart discussion. The second action is manage the environment, that is avoid or remove contamination risk from the patient care environment. And the third action is decontaminate and protect by hand cleansing, personal protective equipment, disinfecting equipment, surfaces, and the key parts. And the fourth action is use the aseptic fields, that is general aseptic field, critical aseptic field, and the microcritical aseptic fields, and protect the key parts as well as the key sites. The fifth action is use non-touch technique, that is key parts must only come into contact with other key parts and the key sites. These key parts and key sites should be protected very, very carefully during the procedure. Next, the last action is prevent the cross infection by using equipment, safe disposal, decontamination, and the hand cleaning. These 6 actions carried out by the healthcare worker by applying the ANTT approach will protect the patient every time we perform the procedure. Next, how we see there are 4 actions that protect every time the healthcare worker from infection. That is protecting you or ourselves every time with 4 actions for safe aseptic technique. Here the ANTT approach is aseptic technique describes the measures we take to protect ourselves from infection during invasive clinical procedures, either during surgery or insertion of medical device or administration of intravenous medication. Any clinical procedures which is invasive in nature, the healthcare workers, we need to protect ourselves from infection. For this, we need to perform 4 actions. Usually we say mirroring the posters targeted at healthcare workers, simpler ANTT approach posters are displayed in the hospital setting will encourage the active involvement of the patients as well as the healthcare workers. So let us see what are those 4 actions that protect the healthcare workers from infection. Is hand cleaning. We always clean our hands immediately prior to commencing the procedure and use the protective equipment like gloves. Here we always think about the 5 moments of hand washing which is being given by the WHO. The second action is using the aseptic field. Protect the procedure equipment from microorganisms by using a cleaned procedure tray and individual equipment covers. For more complex procedures, we use a sterilized drape. And the third action is using the non-touch technique, that we avoid touching the key parts of procedure equipment or any open wound or procedure skin site. If we must touch them, we should wear a sterile glove. And the fourth one is preventing the cross infection. When we remove our glove and wash our hands immediately after we have tied up our procedures, we need to wash and protect ourselves. If we follow these 4 actions, we can protect ourselves from acquiring the infection. The second objective of ANTT implication is standardizing aseptic technique using the ANTT Clinical Guidelines. ANTT principles and methods need to be incorporated into range of clinical guidelines for all common clinical procedures like insertion of the intravenous cannulation, tracheostomy care, wound care, administration of IV antibiotic. For any kind of clinical procedure, we can standardize the clinical guidelines so that everyone, whoever performs the procedure, will follow the same steps so that they can ensure the application of ANTT. This will further standardize the aseptic technique by prescribing out variables and variability and standardizing the equipment and the procedure sequence. This simple method of translating ANTT into standardized practice has proven to significantly reduce the healthcare associated infections. Each ANTT guidelines is sequenced to ensure optimal asepsis, and critical steps need to be highlighted when we list down the steps in the clinical guidelines. Each guideline is supported by the comprehensive rationale and evidence review has to be available so that evidence-based practice will be available. So To conclude the ANTT general concepts, infection prevention and control principles of ANTT always applies. A for always decontaminate hands effectively. Never contaminate key parts of the equipment or the patient's susceptible site. Touch non-key parts of the equipment with confidence, but don't touch the key parts of the equipment. Take appropriate infection prevention and control precaution to protect ourselves as well as our patients from the any kind of infections. So here I will conclude this video. In later or in my next video, we will see how this ANTT technique can be applied in the clinical procedure. I will take any one procedure and detailedly apply this ANTT technique, and we will discuss in the next video. Thank you. And these are some of the references I have made to present this video. Thank you for watching.